Welcome to the series of viewing psychiatry residency through a more practical lens. Here I'm trying to talk to the people specifically who are attempting to run behind the fairy dust after watching Netflix shows representing this very cool branch and not weighing any pros and cons. So let's talk about rehabilitation training. Psychiatry residency in Indian med schools is low-key missing the whole point when it comes to the actual mental health care, specifically when it is associated with general hospitals running on targets and business models. Whether your college is packed with patients or not, good luck finding any real treating therapy or rehab training. The whole treat the person, not just the illness, is pretty much fugazi, leaving all of us clueless about the skills that actually make a difference in patients' quality of life. Next up is very real, very common burnout. Burnout in our residency hits different. Unlike the public opinion, it's not only mental exhaustion, it's physical as well. So we are not standing here in an OT theater for 10 hours, but we do not stop talking and actively listening and assessing for the entire day. After which I bet you won't even feel like catching up with your friend for a drink and rant about your shitty day, as your quota for words per day was already over before lunchtime. So even though you're helping out others with their struggles, it's easy to feel lost in your own. Then comes resource limitations. So psychiatry residency or psychiatry in general in India is playing on hard mode with no cheat codes. You're drowning in patient cases, but the resources are a total struggle bus. There's barely any support staff, therapy programs are almost non-existent. Like I see 8 residents sitting in one room for history taking and psychoeducation every day. Talk about privacy and rapport establishment here. You're basically expected to work miracles with the bare minimum, and you end up learning how to improvise because there is no other choice, honestly. Now, my real nemesis, the inconsistent academics. Psych residency in India is kind of hit or miss when it comes to academics because one week you are drowning in cases, seminars, research work, and next, nothing. Total silence. There is this roller coaster, and education feels like an afterthought. And there will be rarely anybody helping you out, but definitely a room full for critical reports. So most of us are just winging it. I'm not done yet. There's more, trust me, and this is not a rant session. I'm basically talking here to my younger self who thought positivity will be the hue coloring my life once I step in. So bear me a bit and introspect a bit more until we meet next time.